Hello, my name is Dr. Justin McCormick. I own and operate the Chronic Pain Center in Mill Creek, Washington. At this clinic, we specialize in dealing with people with chronic carpal tunnel syndrome symptoms, and we've literally treated hundreds of patients with unresolved symptoms from the carpal tunnel problems. I get asked often, how is it that what we do here is different than what they've gotten at their other providers or their doctors or their other therapists? We specialize in a treatment called brain-based therapy and the wrist track protocol. Okay, when you deal with a neurological problem like carpal tunnel syndrome, you have to correct the nervous system. If you're only dealing with anti-inflammatories, medications, cortisone injections, all you're doing is covering the underlying problem and actually allowing it to get worse over time. That's why most people that we find with carpal tunnel syndrome, they've either gotten no relief or it's actually many times gotten worse over time. So when we deal with the carpal tunnel problem, we're looking at those nerve areas in the arm that we call the brachial plexus. Now, if you look over here, you can see all these yellow strands, yellow fibers coming down. These are called the brachial plexus, and you can see they go right into the hand. These areas are perceived, any type of sensation is perceived in the brain that we call the parietal lobe, which is here on the left and here on the right. That's where if you have any type of tingling, numbness, burning, pain, weakness, any of the many symptoms from carpal tunnel syndrome that you experience, your brain is perceiving it in that specific lobe. So we have to make sure that it's working perfectly. Now, what are some common ways that we can get carpal tunnel syndrome? The most common one is from a repetitive injury, doing the same type of thing with your wrist over and over for years and years. What that does is it causes irritation in that carpal joint. It inflames the nerve. All of a sudden we have the many symptoms of carpal tunnel syndrome. Another thing that can happen is we can have a misalignment in the lower part of the spine. That's where the nerves that come down into the arm and eventually into the wrist come from. So if you can imagine, if I have this spine right here and I were to bend that like this, many people might call this a kinked neck or a twist in your neck. What will happen is it can actually pinch that nerve, and because of that pressure there can actually cause pain and symptoms in the wrist. Now there can be actually some times where people have both. They have a repetitive wrist problem and a pinch in their neck or a kink in their neck. That's what we call double crush syndrome, and that's obviously going to be a more advanced case of carpal tunnel syndrome. We might get what we call a slipped, herniated, or bulging disc, and that looks kind of like this, when that center of the disc actually will leak out and it will cause pressure on that nerve, again, that goes all the way down that brachial plexus and cause pain, tingling, numbness, keeps people up at night, those type of things. We might have what's called stenosis or arthritis in the neck. What happens there is the little tiny openings where your nerves come off of your spinal cord and go down into your hand, that opening will actually close down. And again, that's what we call stenosis. So the treatment for that would be to open back up that canal again. Another really common thing is a vitamin deficiency. Specifically, we find people that are deficient in B12 many times will have the symptoms of carpal tunnel syndrome. With brain-based therapy and wrist track systems, we can actually beat carpal tunnel syndrome, or at least massively reduce it. So the two most common signs that people start with when they have carpal tunnel syndrome, we call these negative signs, okay? One thing is they won't be able to feel or sense their hand as much anymore, okay? And as that advances, they can't even perceive many times exactly where that hand is. So that's an advanced negative sign. So instead of just reaching for a can of pop or something like that, they actually have to look and watch their hand grab that pop, bring it back to them, okay? We've lost that perception in the brain that controls those nerves down into the hand. That's an advanced sign, advanced step of carpal tunnel syndrome. So, like I said, with carpal tunnel syndrome, we can beat it by using brain-based therapy and wrist track protocol. One of the things that we have to do is give your brain, give your nervous system the fuel that it needs. That fuel is glucose and oxygen. Most of us are on a horrible diet, okay? Your nervous system has to have the right amount of the good healthy glucose. And if we're getting bad food, if we're eating junk food, it's not going to heal like you want it to. The other thing I said is oxygen, okay? Your brain requires oxygen for it to work like it's supposed to. When we put people in our office on oxygen concentrators, they start to heal almost immediately, and they can feel that brain, their nervous system start to work again like it should. Another thing is we'll use activation, okay? We use a device called an activator where we stimulate different areas of the nervous system that aren't working like they should. Your brain, your nerves, they start to fire properly again, and we'll see a massive reduction in the signs and symptoms of carpal tunnel syndrome. I've talked about the wrist track protocol. Most people have not heard of it. It's a device that we put on the wrist. It opens up the wrist and kind of decompresses it. It takes that pressure out of that carpal tunnel area. You know, all that tension, all that pain that we feel in the wrist area, it opens that up. Another thing that we use is called laser therapy. With laser therapy, we shoot lasers of light into the wrist. It stimulates your wrist, your nerves to heal faster, and it decreases the inflammation so we can decrease those symptoms as quickly as possible. Now, I went through today the causes of carpal tunnel syndrome, the many symptoms and signs of carpal tunnel syndrome, and how we're going to fix carpal tunnel syndrome. If you want more information, or if you are ready to fix this problem, call my office. It's on the website. You're going to get a report in the mail and all that stuff. Go through that and give our office a call. You have 2 free trial visits available for you. We're going to go through your entire history of you, neurological exams, so we know exactly what's happening, what's causing your carpal tunnel problems, and then we can go about the proper treatment plan to get this problem fixed. Thank you guys so much for your time, and I look forward to seeing you, meeting you, and helping you as much as we can. Thanks again.